just letting in on this, Esther will run us through on exactly how we'll go with this, and then also what is coming up in this webinar. Esther?
Thank you so much for that, Meg. In the words of Malcolm X, and I quote, "The media is the most powerful tool on earth. It has the power to make an innocent man guilty or a guilty man innocent." So this basically shows us that media is quite a powerful tool. The webinar today covers the role of media, particularly in addressing COVID-19 disease. The objective of this discussion is to help journalists understand their role in helping audiences to protect themselves and others from the new coronavirus disease and to be able to manage information during the COVID-19 pandemic. Please note that this is not a media briefing. This forum is focusing on our role as media in response to COVID-19. We will take 5 minutes to hear top tips from the panelists, and 45 minutes will be for Q&A. Please use the chat box, as Meg mentioned, for your questions, and also please tell us which media you are from, because it will be interesting to know how many media houses have joined us. If you would like to speak, you can wave your hand and the facilitator will unmute you. Right now, I will introduce our panelists. On our panel, we have Meg Perry, and Meg Perry is Coordinating Mentor for BBC Action. Good afternoon, Meg.
Afternoon, Esther. Thank you.
We also have John James, who is Chief of Communication, UNICEF Zambia. Good afternoon, John. We also have Patricia Sinyangwe, Project Manager, BBC Action Media. We also have Ida Hughes, and she is with Global Health Media Advisor, Internews. And I would also like to mention that Ida will leave us at a certain point in time as she has other commitments. So with this, I would like to call upon Meg, who will take us through being prepared and coordinating.
Thank you very much, Esther. So welcome once again to everybody else that has joined this webinar. And the big question we have is that what can we do, the role of the media in responding to the new coronavirus and COVID-19? And one of the things that is quite very important as a media is for you to be prepared and for you to be able to coordinate your work around reporting, covering, and also producing content around COVID-19. We'll share a little bit about what we've done as BBC Media Action, our experiences, how we've prepared ourselves, and how we've coordinated ourselves. So what we've done is that in responding to the COVID-19 crisis, we formed a task force at the BBC Media Action that was meant to prepare ourselves in responding to issues around COVID-19 with partner stations that we work with. If you may not know, BBC Media Action works with media around the country. So we've got partner stations, over 23 of them, that we work with, try to bring in capacity development and a lot more other projects that we work with them. But what we've done now is that we decided to say, okay, let's share what we've learned from other country offices, what we also know around COVID-19. So in terms of being prepared, we prepared ourselves that we'll be able to respond to whatever issues our partnership stations had in terms of being prepared. And how would they coordinate this is that we provided capacity development in terms of lifeline training, issues to deal with misinformation, and also identifying fake news, and also suitable content for their audiences. So this is what we've tried to do. Now, there are 4 points here in you've been prepared and how you could coordinate. Number one is, how do you understand the science and the issues? Follow the science, but avoid scientific jargon, make it clear for your audience. I'll expand a little bit on that. And also the second point is understand the response, who is doing what. And another point is that you should be able to build your contact list based on the response. Who can you speak to? Learn from other contributors or guests that are around the programs that you're producing, or people that you are talking to. And also, it's important that we remain safe in whatever we're doing. So it's very important that you do not endanger yourself or endanger anybody else, your audience, and also the people around you. So quite very important that that is done. So in terms of going through these 4 points, we start with point number 1 in how do you understand the science, is that when we report, our audiences are looking at us and looking at us for solutions and for information. So we must be able to report and simplify any information that we get, as much as it is complicated. First of all, you must be able to explain this science. What is COVID-19? What is also the coronavirus? Because these are things that people are asking. So explaining it in simpler terms, that would mean to say people will then understand, okay, what is the difference or what are people talking about? But make it as simpler that people understand and our audiences will appreciate our role as media, whether we are broadcast journalists, whether we are print, and also whether we are targeting, because we target different people. So it all depends on who you're writing for and who your audience is. So quite very important for us to be able to do that. Another point is that we must be able to understand the response. Who's doing what? Who's in charge of what? Where do we get the information we need? Do we need to get it from WHO? Do we need to get it from UNICEF? Do we need to get it from the Zambia Red Cross Society? Do we need to get it from the ministry in charge? That is for those that are joining us from outside Zambia. We have the ministry in charge, that is the Ministry of Health. So these are the custodians of all information, and anything around COVID-19 or any public health emergencies. We rely on them, and building a contact and knowing that these are the people that you need to talk to is quite very important. So point number 2 in you understanding the response and who's doing what is quite essential, because then you know that if you need information, whether it's numbers that you need, or maybe stats, or maybe what is some new pronouncement, you know who to contact. Who shall I speak to? Who will I have a chat with in terms of that? So that is another way that we could do that with understanding who to contact. And also, what is important here is that what we've also done as BBC Media Action is that we've learned that we need to build a contact list. That is working with people that are probably in other organizations, like-minded organizations. BBC Media Action sits on a group, the Public Health Communication Group, that is focusing on radio and TV. So in this group, you'll find non-governmental organizations that are working towards messaging content around COVID-19. So that means to say that when we are in this group, we are seeing what our colleagues are doing, how it can work, who will help in terms of any information that we need. So in Zambia, the Public Health Communication Group, which is working towards this, has helped quite a lot. And in that group, at this point, I'll allow Esther to come in as well, because the Zambia Red Cross Society is actually doing things around responding to works around COVID-19. We seem to have lost Esther with this, but I think what we'll try and do is that she'll come in later, because we're not getting what she was saying. Red Cross is doing quite a lot of work around it, and what they've learned as well, experiences around that was very important for us to learn what they're doing. But as I was saying before I went to that, is that we've built a contact list. Who can you speak to and who can you learn from? That is quite very important, because what we've learned is that we do not duplicate work that others are doing. For example, BBC Media Action has produced short dramas that are in different languages. We've produced these short dramas in Kikaonde, in Bemba. We've also produced them in Tonga, and Nyanja, and Chichewa. That means to say, and including English, that means to say at least we're catering for quite a diverse audience. So we had to do that because we learned through by sitting into these groups where we're learning to say, this is what our colleagues are doing. But key to this is that when you build this contact list, you know who to call just in case you need something. BBC Media Action produces content for maybe young people. We also produce content for masses. But when maybe a program on one of our projects that is focusing on young people needs a public health expert to maybe come and explain issues around schools opening. We know who we can target, we know who we can get to because of building this contact list that we have. Equally in that group, an organization called Save the Children has helped in trying to give us and help us with information that is getting us to understand how young people are waking. And this is what we've been trying to do. So, I mean, having a very good contact list, you networking with quite a lot of people is very, very important and is quite key. As I conclude, I did mention to say that safety starts with us. It's very important that we stay safe. And speaking to which is that we must make sure to say, if we're going to be working remotely, are we able to use alternative means of conducting interviews when possible? If you can't go to a particular place because then you've been told to say you need to speak to somebody, you can either ask them to send you a WhatsApp message, a voice note, that is possible. Do we ourselves follow recommended preventative measures apart from washing hands, social distancing requirements? What about wiping down equipment that you're using, the vehicles that you're using? But I'm aware that in this country, not all media houses will have maybe provided transport for their members of staff when they're coming from home. They'll probably provide transport when they are going for that particular assignment. It is important that we value the safety of our colleagues. So then the other question is, how do we take care in crowded places when we are covering this or when we get to use public transport? Do we follow these guidelines? What is important is that if we keep ourselves safe and we can't spread the coronavirus, I mean, we're not aiding anything here, then this means to say we've got audiences who are happy. And speaking of audiences, the next station, who's John James coming in just a minute, we'll be talking about how prepared we can be so that we can give content that is good for audiences. Thank you very much.
Great, thank you very much. I hope you can all hear me properly. So my name's John James. I'm the Chief of Communication at UNICEF Zambia. Before this career, I was a journalist as well for about 10 years, working for the BBC and ITV in the UK, and then for the BBC World Service in Congo, and then in Ivory Coast. I was the correspondent in Ivory Coast when Zambia won the African Cup of Nations. That was a hard day. And then I worked in the Middle East as well. So I'm just here to talk just for a few minutes about audience. And I think, you know, as professional journalists, you sort of know already how to write for your audience. But I think what we're talking about here is really almost doing a public service in your work, in playing a role in giving people the right information they need. Because people talk at the moment about an infodemic. That means that there's so much information circulating that, you know, as journalists, you're the traditional brokers and informers of people. And so, you know, I think you have a really important role to play in this whole pandemic in giving people the right information and showing your credibility and how you give an authoritative version of what's going on. So that's a really key role. So I think that's where we talk about knowing your audience, because we know that our audiences have very different perspectives on the situation at the moment. When we give a report, when we write a feature, we're writing to people in a particular context. People have their political persuasions, people have their religious views, people have their ethnic groups, people have their age, people have their gender, and all that sort of colors the way people interpret what you're saying. If we just take that one of age, we know with coronavirus that you know, particular groups are really vulnerable in society, and those who are older seem to be the ones who seem to be dying the most. So those, if you're an old person, if you're over 70, say, how you listen to stories about coronavirus will be very, very different from how a young person listened to that. And that may be in the wrong way. A young person may be listening to your report or watching your report and thinking, oh, that's not for me, I'm not at risk, I can't do anything here, I've got other concerns. And so they'll be really sort of interpreting what you say in different ways. The other thing with our audiences is that we may accidentally be pushing some buttons that we don't need to. The sort of metaphor there is that, you know, people may be primed to hear things in a certain way that corresponds particularly with maybe ways of seeing the world that they already know about. So, I mean, we think back to the beginning of coronavirus, and of course, we know it started in China. And you remember those early days in February and March. People were quite scared of people from the Chinese community. Now, stories about that is coming from a context we know in Zambia where there's a particular narrative about Chinese people in the Chinese community. So that sort of fits in, and that's how our audiences might be hearing what we say. Another important part of the audience and where they're coming from is what they know about public health and where they're coming from. So if we think about what's happened in public health in Zambia over the last few years, we can think about Ebola next door in DR Congo and the outbreak in West Africa, which I was working on as well. So, what does Ebola tell people about public health emergencies? It gives people a lot of fear. People die very quickly. It spreads very fast. There's a lot of panic. There's a lot of mistrust as well. I think another part of the environment on public health in Zambia is cholera. So people know about cholera. People are used to having cholera here over the last few years. And so that interprets the way people talk about coronavirus. I think one thing we've seen particularly is that when we've been trying to persuade people to wash their hands, people have kind of understood, and we've seen levels of hand washing go up quite nicely. Because people are used to that, I think, from cholera. That was a big message in the cholera. It's not the first time people are seeing that. Even some of the animations that as UNICEF we've been playing on ZNBC and the like have been traditional hand washing animations that were done years ago, and actually people even know the theme songs too. There's the world around vaccines. So generally it's not touched Zambia too much, but over the last few years there has been a lot of discussion about sort of conspiracies around vaccines. A movement saying vaccines are dangerous. Now that's not true, but that does color the way people are interpreting things. Then of course HIV/AIDS, that's there in the audience's minds. So they're used to these big pandemics. And how do you think about coronavirus if you're thinking about HIV? Well, HIV is a disease that is treatable, but it stays with you. You can't be cured. So if you're thinking about that in the audience's mind, when they're hearing about coronavirus, then what do they think? Oh, maybe you can't be cured of coronavirus. Maybe when you have it, it stays with you forever. And if that's the case, then how will people treat survivors, people who've had coronavirus and then recover? Of course, with HIV, you can't do that in the same way. So how will that affect stigma and some of those issues? Let me turn to another area. Think about the school reopening. That's been an area of debate over the last few weeks. How is the audience thinking? And then again, that depends on who they are. How do children feel about schools being closed? How do parents feel about their children going back? How do teachers feel? How do employers feel? Everyone has their perspective on that news story. And as we seek to communicate information to them, we need to think about what may be kicking off some things in their thoughts and also how it may color what they're thinking about. And when we talk about audiences, we know, it affects the stories we write. What's going to be interesting? If everyone's talking about this concern, boarding schools, are they safe? Is that going to be a major place for the epidemic? Then we can tailor our stories to that. And of course, the way we write then is also tailored according to what we thought about for our audience. So more quick points. As sources of information, we know that we don't have, as journalists, there's no longer a monopoly on telling people what's going on in the world. People have their smartphones, people are being given information all the time on WhatsApp and the like. Much of it is really not reliable. There's a lot of fake messages out there. There's a lot of very partisan, very extreme activists out there who are using this platform. I think people are getting cleverer, but you can still see a lot of people are taken in by a lot of this as well. So there's that balance. People are receiving lots of information now that's not coming through journalists, and you need to be that trustworthy source. You need to uphold the values of the profession, that you give tried and tested and verified information before passing that on. Because I think the danger is that as journalists, we can slip into picking up that juicy information that was circulating on WhatsApp without doing the proper work, and that can undermine the whole profession. Meg already talked a little bit about communicating science, and I think that's another important part of how we speak to our audience. So, how much do they understand about the science? How much do we understand about the science? What do we know about how coronavirus is passed on, how to stay safe? What do we know about masks, the type of masks that work? Why do we wear masks? All these things about numbers. People talk a lot about exponential growth. Do we understand these things? I think as journalists, it's important to do the groundwork and understand these very complicated issues, and then that even more difficult task of communicating them to an audience that doesn't really have the time to do that work, but needs a simple way of understanding what's going on. So as journalists, where can information be had? Well, first of all, I think journalists, as I was saying, need to be doing the research in the background. There's a lot of work going on there. We can see and read about what's happening in other countries, and that can help us to understand, what might be happening in the future. Of course, there's many unknowns, and we have to be clear about that as well. But I think we can do our research to understand what's out there. The example of Italy. So if someone says, oh, the country only has 4 cases today, if we've done our research and we know what's going on elsewhere, we can say, well, Italy only had 4 cases on the 20th of February. And then a month later, 20th of March, they had 47,000 cases. So this stuff can really change. So that helps us to understand what's going on here. A final thing, as the co-chair of one of the subgroups that helps in the Ministry of Health organization of the coronavirus response on risk communication, we develop a social listening report. We're currently producing it every 2 weeks. You can download this from Relief Web if you've been to the website. And it tries to look at the conversation so that we can understand what people are saying about coronavirus. And that's really an important part of understanding the audience, because then we know the messaging that we can give out. As I say, I was working in Sierra Leone when there was Ebola. And so a big thing that we used at the beginning was Ebola is real, because there was a lot of doubt about Ebola. But eventually we changed the messaging. It was a bit more about, Ebola stops with me, getting people to do personal actions to stop Ebola. At the moment, we're seeing, as I said, hand washing is being well understood, but mask guidance is not. So if you can try and find the social listening report, I'll include a link. Look at that and try and see as well and understand how people are talking about coronavirus. Just a final thing, a small plea from me. What we're seeing in the news and from listening myself to what's going on out there, we're really seeing people talking a little bit less about prevention. And I think those messages are still really important. So would appeal, just still be doing all you can to spread that information about how people can stay safe. Yes, some people have heard it many times, but many people still haven't got the message. And that's really how people can protect themselves. Okay, let me hand over to Patricia from BBC Media Action.
Thank you, John. Indeed, it is our obligation as communicators, our obligation as communicators lies with our audiences, and understanding our audience is key. In fact, this leads to it actually helps us find effective ways of helping people to cope and to take action. You will all agree that media coverage in public health emergencies often focuses on overviews of the situation, such as the scale of the emergency or the death toll, the negatives, human suffering, the failures of government. But we need to remind ourselves as communicators that, especially in a health crisis, we need to remind ourselves that above all, what people need, or people who are affected or at risk, what they need is news they can use. What do I mean by this? This is just basically offering practical information that people can act upon to improve their situation. This is very important. Why is it important? It helps build understanding. It helps people have a realistic risk perception. News they can use. That practical information can bring about discussion and dialogue through which our audiences find solutions. The best we can do to help our audiences, help them find solutions themselves. We do not have all the answers, but when we facilitate, they can actually have the discussion and the dialogue. They can discuss about what resources do they have within their communities that can help them to help themselves. This will ultimately help our audiences feel empowered. It can be through skills, some things that may seem as simple or as basic as just learning how to use a mask correctly. Helps to motivate our audiences. When they are motivated, they are more likely to act to prevent the spread of disease or share knowledge amongst themselves in terms of prevention, how is COVID-19 affecting them. We can all agree that yes, in fact, it's to emphasize that information such as steps of prevention, official measures, and advice that are given are very important, and we have a duty to share as much as possible. But the challenge is upon us as communicators in terms of how can we go a step further? How can we go beyond this? How can we go beyond the usual? And I think at times like this, that calls for our creativity in terms of how can we go beyond the numbers and the statistics in trying to help our audiences. John spoke about vulnerable groups. Have we thought about them? Have we gotten their voices heard? We are challenged to come up with programs that are specific to them. John talked about they're listening to the messages differently. How can we tailor programs for them that actually appeal to them and help them in terms of coping with the situation, coping with all of this? There are issues of managing stress in this, and our audiences are listening to these messages differently. I'll give an example of people that have other health needs, access to antiretroviral therapy. They are looking for different messages. Are we thinking about them in terms of how does that affect their access to antiretroviral therapy? How does this affect access to contraceptives? There's a woman out there that is thinking about, can I still go to a clinic? Am I at risk? How do we then strike a balance in terms of, yes, we're dealing with COVID-19, but digging deeper into what affects our different types of audiences. It's thinking about issues like loss of income. A lot of people have been affected by loss of income. How are they coping? Simple issues like something that we did, for instance, in Kasama is showcasing a young woman that learned how to sew masks and is selling those masks at a humble fee, generating some sort of income, sharing such stories and giving people ideas or helping come up with ideas in terms of, yes, this is happening, but I can do something about it, or I can actually cope in this way or that way. And with COVID-19 also comes an issue of audience interaction. It's very important when it comes to dealing with a health crisis. But with COVID-19, we're also battling with the issue that we are telling people, make only necessary movements, only when it's necessary, stay at home as much as possible, only when it's necessary. So a challenge with us communicators now is to get our audiences, or get to think about, how do we make our audiences feel like they're still interacting? How do we bring them together? It could be with in discussions such as the one that we're having right now, taking it to radio. Can we get ordinary people having these discussions on radio, for instance? Can we get ordinary people, whether I'm writing is a story in the paper, just to air their views, for instance, getting people to feel like there's still a sense of community in as much as we were doing this helps them to cope with the situation. And also facilitating the flow of information with experts and the community is very important when dealing with the health crisis. And this is a challenge also in terms of how can we do that as journalists. In as much as we are communicating, it's very important that even as we are giving out information, we look at how realistic is the information that we're giving out. Yes, we're saying wash your hands as much as possible with soap. Wash your hands, or if you don't have soap, use hand sanitizers. But think about your audience. Do they have access to clean water? Do they have access to hand sanitizers? When you send out a message such as that one, do you leave your audience feeling helpless? How can you get them to think about alternative ways of protecting themselves? Well, if you don't have access to clean water, if you can't access hand sanitizers, try as much as possible to stay away from or to social distance, to cough into your elbow. What else can you do? Empowering our audiences with information that they can use. Another very important aspect when dealing with a health crisis is sharing positive stories. This helps in terms of, like the example I gave of finding a source of income in all of this. And also trying to balance in terms of, yes, sometimes we want to use fear and shock as a tactic to get people to actually be aware and to do something about it. But we need to be very careful in terms of, are we going to get them to switch off completely? Because when it's too much, people switch off. So we need to think about, how do we draw our audiences back? Other emotions can be effective as well. Can it be humor, for instance? Can we get people that they listen to, the celebrities, or to talk about it, but also being mindful that these are not experts and they might actually give out wrong information, but they can share information about social distancing, coughing and sneezing, etc. So these are things that we need to think about. So I think it's about finding ways to make our audience interact, getting them to have access to correct information, empowering them, making them feel empowered enough that even if I can't have access to hand sanitizers, for instance, I can do A, B, C, D. Other people are coping in this way. Other people have found ways of making or generating income. How else can I do this? And the challenge is upon us, and I will leave this challenge with all of us in terms of how can we think outside the box when it comes to COVID-19. And lastly, we also have a very important role of countering rumors, mis and disinformation as communicators, and I will hand over to Ida to look at this one. Thank you.
Thank you so much, Patricia. I hope everybody can hear me exactly. Alongside all of this new science and having to cope with, you know, the fears around COVID-19, all the new science, which is moving at an incredible speed, we are also coping with a misinfodemic at the same time. So there's both an infodemic, as John and others have already said, so just a sort of mountains and mountains of information, and then absolutely in parallel with that, misinformation. And so, I mean, it's important for us to even ask ourselves, why is there so much misinformation? And I want to say, perhaps you can hear from my accent, but I'm not Zambian, I'm South African. So Zambia is one of my neighbors, but I'm in touch weekly with a group of journalists in the Zambia Media Science Cafe. They're journalists who've been putting their minds together over science over some time now. And when COVID-19 happened, they said to me, you know, there's so much here that is really similar to what they've faced as journalists with HIV. But at the same time, of course, we also have to recognize that some of those early HIV stories were around way before some of those on the call were born. Many of us are fortunate to have lived in an era of ARVs where HIV is being managed. But in the early days, this misinformation about HIV was as rife as it is now with COVID-19. But I would say it feels certainly as if there's even more misinformation than ever before. It's such a new virus. It has spread so fast around the world. And there is also so much information, which is really difficult to digest at this pace. So alongside all the misinformation, you will all have noticed, there have been many organizations who have traditionally been in the field of fact-checking, and even new small startups or new organizations or even individual journalists, particularly some of those working in data journalism, who've come forward and offered their services as fact-checkers. But sometimes those services cost money, and sometimes the facts that we need checking aren't being checked by those services. So already there's a dilemma or need for journalists to kind of, you know, make an extra effort. I think one of the best ways to fact check is to actually pair up with a scientist and with people from civil society who work in the health field, whose job it is to actually know those facts, to just interpret the facts and also translate the science to an ordinary person. So I think that whereas in the beginning of the epidemic, which became a pandemic, we used to see Dr. Fauci on the screen, you know, the advisor to President Trump a lot, we sometimes maybe forgot that there were also scientists, top experts in our own countries who could help us check those facts. There's Africa CDC, there's the WHO has a strong presence in Africa, and those are places where we can go to have our facts checked. Just about all of this new science is available, of course, on the most known credible sources. The BBC is a very credible source out there. So if a journalist kind of hears about a new item in the science news, I would say if the BBC hasn't reported it and other credible sources, Al Jazeera and so on that you may be following, hasn't reported on it, it could be that it is untrue. And we saw a lot of that in the beginning. What happened in time is the social media platforms started to adopt strategies to actually also fact check and even fact check now some of the sources and point us in the direction of credible sources. So in terms of fact checking, as long as we follow the credible sources, WHO, CDC, and the credible, very well-known media outlets, I think we're rather safe. But there's another area that goes hand in hand with fact checking, and that is what we like to call at Internews a reality check. So most of the time, it's not just enough to know what the correct facts are, but it's as important, I think John alluded to this issue as well, it's as important to know, to do a reality check. So regardless of what the correct fact is and how we go about to correct that fact, there's a reality check that our audience, they are so important, that our audience themselves may continue to believe that misinformation, or they may continue to pose questions, which we need to have. We need to have that ear on the ground, so we know what are the questions that our audience is posing, what are the things that they seem to be believing and forwarding on WhatsApp groups, or what they are discussing at home. And that is actually our clue as to the type of stories we should be telling. So for instance, my colleagues and friends at the Zambia Media Science Cafe told me that there is still quite a strong sort of discussion out there that COVID-19 is not real. Earlier, Petronella asked us on the chat here, why is it that the prevention messages don't make up enough of the public discussion or of the media discussions? Perhaps, one of the reasons is that in sub-Saharan Africa, we're still at a relatively early stage of the wave of the pandemic. I like the example that John mentioned about Italy. Perhaps people can't see a vision yet of how it might be. Perhaps it's just also unbearable to think of that vision. But I mean, if the reality check that we do is to hear that people say that COVID-19 is not real, it gives us as journalists ideas, story ideas about the types of stories we should do to make them see that it's real. My colleagues at the Zambia Media Science Cafe also told me that there's a strong perception still that Africans, Black Africans, are not affected so much by COVID-19. And I mean, that is a myth, and we know that, but we also know that the discussion has been out there. So again, it's an ear on the ground that tells us what is the type of story that we then ought to be telling. It's no use repeating that myth or the misconception because it just amplifies it. What we can say is, okay, we hear that there is that perception. Why don't we do stories with survivors, with patients who have emerged from hospital, you can describe their experiences, or even those who've been in quarantine and those who've, had a real brush with the virus. That would be a way of saying, okay, there's that perception. Let me do a story that corrects the perception without repeating the misperception. I think it's always a challenge for us as journalists when we know, for instance, I also hear there's a belief that lemon juice, gargling with lemon juice would be, would ensure that the virus doesn't go down our throat. And even as I'm saying it, I feel I shouldn't say it, because when we repeat a fact, when we repeat information or a notion that isn't true, we always stand the risk of actually augmenting that, because we also know there are theories in communication that when people hear a thing often enough, they start to believe it, even if they hear that that thing is not true. So that's very important for us to bear in mind as journalists. So the lemon juice thing, which I'm repeating, but I shouldn't be, I think the way to counter that is not to mention lemon juice, but to mention that there is still no known cure, and then perhaps report on the science about, all those incredible efforts around the world to find an eventual cure, and, just also highlighting that it will take time. But that brings me back to Petronella's question, why aren't there more prevention messages? This is the only science right now that helps us is the prevention science that has to do with hand washing and physical distancing and avoiding public spaces, working from home. If we have the privilege to be able to do that, we should do that. And that's science. It is science. The other science is happening in laboratories, is happening in clinical trials, and we don't have the findings from the other science yet. But the science that's robust, that we know has worked, and we've got lots of illustrations around the world. New Zealand is an example. Very, very, very strict lockdown. And the cases and the flattening of the curve and the success story of New Zealand is incredible. I know our circumstances are very different, but there is still the science there that we can keep on emulating, especially since the wave of the pandemic hasn't fully hit us in this part of the world where we live. So, that is really what I meant by reality check, is that what for real is it that people are saying and thinking can be a way for us to kind of gather story ideas and say, so if people think this, then I ought to do a story on this. In other words, the story itself corrects the fact. So by having done a reality check, by really listening to what our audiences are thinking, we can really play a major role. Just also to say, just a reminder, I think everybody knows it, but it's so important that I just want to say it again, is that these are really, really extraordinary times. We can sometimes, especially as there's a push to reopen economies around the world, we can forget that the virus is still with us. The virus must always be in the equation of whatever decisions are made. If our governments, in wherever we live, don't follow best science, we still have some kind of a possibility as an individual to follow best science. And we as journalists definitely have the opportunity to follow the best of science, that science has to offer. So in a pandemic, which is a most unusual circumstance, filled with fear and filled with a future that we can influence, it is really important. It is so helpful if there is public faith in institutions, and the media is an institution. So if there is public faith in what the media has to say, if we've been clear about not forwarding misinformation, not sort of forever presenting unproven remedies or ways that that haven't solutions that haven't gone through clinical trials, we day by day will erode public trust. Because, for instance, if you take hydroxychloroquine, you must have all followed that there was a notion out there that it would be helpful against COVID-19, and is now not only found to have been not helpful, but actually in fact harmful. So if we as a media house just go along with those public statements that politicians make, and then we have to retract it, or then it's found to be untrue, little by little, the faith in us as an institution will be eroded. And then when we come with a good science and with those announcements that help to save lives, that news that we can use, that Patricia spoke about, then we won't have achieved anything. It's just an incredible responsibility to ensure that the public keeps faith in us as an institution. So yeah, that's really is, so those are some of the messages that I wanted to bring across. A last item that I heard from the Zambia Media Science Cafe is that people feel they absolutely would love to see more stories just of ordinary people coping, just as Patricia was saying, and particularly of patients. And in time, those stories will mean a lot. We've done those stories. Older journalists definitely have done those stories in terms of people living with HIV, and they've played a major role in breaking down stigma. And I think the time is there for us to do those stories of people who've had COVID-19. There's no shame in it. There is actually celebration in it, that in fact a large percentage of people do come out the other side. But the public needs to know that, both to see that the virus is real, but also to see that it isn't only filled with fear. But that doesn't mean to say we shouldn't be careful all the time. So I think I'll stop there. I think the questions that have come in are really amazing. And I think we're going to take the discussion further now through looking at some of the questions.
Ida, thank you so much for that in-depth explanation that you've given us. That was great insights. Also, Meg, thank you so much for your contribution on being prepared and coordination. And also, John James, thank you so much concerning your how we can be able to understand our audience. And also from Patricia, who shared with us on helping people to take action. And then also I would like to add on, I apologize that earlier on, my mic, I think I lost touch with everyone, but there was a problem with my network. But also I would like to add on with what Ida has mentioned, the myths that are there. You have right now, one of the latest myths that I got was, there must be a cure because how come people are recovering? So in other words, then possibly this thing is not real. And then also as journalists, we get the numbers that come in. Take for instance, every week we are being given numbers about how many have recovered, how many cases are confirmed. What do we do with those numbers as media? As I was saying earlier, when I was not able to reach out to everyone, but basically what I was saying was that under Red Cross Society and IFRC, we make an emphasis on being able to gather information that is correct, gather information that is from the right source, because that is extremely important. when we gather information that is correct and we're able to share it out, we're able, as media people, as communicators, to be able to disseminate the correct information. So with that, we're going to go into the Q&A. And because Ida is leaving, Ida, I will direct the first question to you. And this question is coming from, okay, I'm just looking at my questions. The one from this question is coming from Petronella. And the question that Petronella is asking, what are some of the reasons for the lower focus on prevention reporting in COVID-19? I think you answered that.
I want to
Ida?
say that I managed to negotiate. I no longer have to leave early. So, but thank you.
Okay.
Yeah.
Okay, that's fine. Then I can go ahead with asking the panel the questions. So Meg, this question is directed to you. And this question is coming from Anonymous. And it's directed to Meg. And the question is, actually it's coming from Joseph Peary, ZNBC Radio 2. Why is it that every time the word frontliner is used, only doctors or medical personnel come to mind? When will journalists be recognized as frontliners and receive incentives from government and other relevant bodies?
I'm going to begin from the incentive part. I'm not so sure if I can speak on the part of giving anyone incentives, but I feel to say whatever you do, you know, to say you're important and you're informing the public. So you should consider yourself as a frontline staff, because you are providing information for our audiences and for our communities and for a better Zambia and for everybody else to be informed and know that this is what is going on. It's a calling. You're doing a very good job. So there's no need for us to sound the drum really to say, well, look, listen, we appreciate what journalists are doing and what media people are doing, and everybody else is doing that. If people are not saying it, we shouldn't get discouraged. What I would say now is that do the best you can. And one day somebody's going to come up and say, look, listen, we wouldn't have done this without the media.
Thank you, Meg. And I also want to add on that I think the incentive that they're talking about is being able to be appreciated. I am making an assumption that this is what the incentive that this person was talking about. This next question is directed to Ida and Patricia. What criteria can we use to convince a guest to come for a radio program? Not sure what, okay.
Can I think, all right, I'll try to answer. I saw that in the chat earlier. I think I want to say, maybe I might not agree with the assumption of your question, because especially if it is a radio program, it can actually be handled by phone. So when you say you would like to convince a guest, I would want to say, let's convince ourselves. Let's be very, let's do that difficult task of saying, what of our role as a journalist can we do without physical contact? And I would say as much of it as can be done without physical contact. That's our contribution to our own safety and to the safety of our society. It's not just about not getting sick. It's about being part of that contribution of not overwhelming the health system. So if such a thing can be done, if the information can still be gathered without people moving from office to office or from office to studio, I would actually say do that via a phone in.
And maybe also just
Thank
to
you,
come
Ida.
in.
Yes, you can go ahead, Patricia.
Thank you. If, for instance, maybe it's a challenge in terms of people denying to actually feature on a program, I think it goes to maybe taking it back to what Meg was saying. I think that's why that point in terms of coordinating is very important. Once you are coordinating, you know who the responders are, you know who the health experts are, you form a rapport with them, you're able to communicate even outside your program, then it's easy to get people onto your program. I think it starts from there, and I think that's why that point even comes first in terms of preparation, coordinating. It helps in terms of getting those relevant guests to feature on your programs.
Yeah, you're right, Patricia. I think that is what was meant by the question. Excellent, thank you.
Okay, thank you so much. This question is now directed to James, and the question is, how should I, as an investigative journalist, get a story from a survivor of COVID-19 without being at risk of contracting the virus? James,
very
are you
good
with
question.
us? Pardon?
Yes, I'm here. Yeah, very good question. And a lot of this does take me back to sort of 2014 in Sierra Leone. Interestingly, then the BBC hardly sent anyone to cover Ebola in the early days because the health and safety people wouldn't let anyone into the country. So CNN were covering stuff, and they were sort of relying on telephone interviews. And even when they used when you'd bring a survivor into your own office to speak with them, their lawyers were sort of very careful. Did you invite them in? Did you take the precautions and the rest? But the story of survivors in Ebola was very, very important early on. You remember people had great fears about these people like zombies, infecting people. And the story that survivors recover and are safe just reinforced so many important messages about this being something you can survive from. Because if you can survive from it, then you might go to a health center to be treated. If you can't survive from it, you're not going to go away and accept to go in an ambulance. Stigma as well, seeing that these people are ordinary people, seeing as well that it's a real thing, ordinary people talking about it. It's not something made up by aid agencies or political parties to try and get some money. This is a real disease. Here are people who had it. You can recover, and here they are. Now, in terms of people who have survived, I think you need to keep the general precautions that are there. I'm not a medical expert, so I'm not talking about this from any scientific background, but you need to look into, how can you stay safe with people who have survived. My personal understanding is that if people have survived, then they've combated the virus and they're sort of clear, but you should take the regular precautions you take in terms of using a mask and keeping distance, reducing physical contact and the like. But I'm really saying that, as a proviso, but I'm not a medical expert. So you need to consult with the right people. But at the same time, I think it's a really important story. Now, how do you find those people? That's a bigger question. And also, how do you protect them? Because they are potentially open to stigma in their communities. We've seen stories already of children who have survived and then faced stigma afterwards. So it often takes some brave individuals who are willing to come forward, and you need to help people to understand what it means if they're coming forward as a survivor and showing their face and potentially having themselves open to stigmatization in their communities. But for those brave individuals, we call them heroes in Ebola, and I think they're heroes here as well. They can play a really important role. And for journalists, you guys play an important role in really highlighting those cases so that people can communicate and, as I say, pass on those really important messages. This is a disease that can be survived. Many people do. It's real. We need to take precautions. It's a nasty thing to get. So this is not a light thing, but it is survivable.
Thank you so much for that, James. And I think the key point there is basically to protect yourself and to also be able to protect the person from whom you want to get the information from. My next question goes to Meg and Patricia, and this is coming from Kennedy Gulo from Radio Mano Community Station. And the question reads, do you think our audiences believe there is COVID? Some are saying it is just a normal disease because in Zambia we have seen recoveries. Meg and Patricia?
I think the audiences should be believing that this is real. John is just from saying this, that this is a nasty thing. You don't want to get it. And so if there are any doubts, I think this is the time that the media has to play a role by playing all content and programming around educating our listeners about COVID-19. This is what they should be doing. We can dispel these rumors if we use our channels for this, just for this time.
Yeah. Also, just to come in, even I think from the research that we've carried out as BBC Media Action, that's a very real question, and a lot of people, I think, are questioning whether COVID-19 is real. We've gotten a lot of responses, or people saying COVID-19 is not real, but I think this is a challenge then that I'll throw to us as communicators in terms of how do we package our information to show what is actually happening on the ground. Survivors, how do we get survivors to tell their stories? How do we get people to say what they went through when they were in hospital, for instance? I think these are the stories that we need to be telling to actually show what is happening. And the challenge, the more people are saying it's not true, I think the bigger the challenge it is for us as journalists.
Could I maybe add something, please? I think that maybe this thing about it's not real always comes about when something is new. It was there with HIV, and it was there with Ebola, and now it's there with COVID-19. And maybe another strategy we can use is to say, there are also other diseases from which people recover, and it doesn't mean it's not real. Malaria, not everybody dies of malaria, but it doesn't mean there's no malaria. So one can maybe also kind of, think of some of those parallels as a way. I'm just thinking it might help.
Okay, thank you so much for that, Ida. I would also like to add on to that, having been in the field myself as we were disseminating information, what I did find and discover is that in a certain area, it's a high density area that we were in, disseminating information using public address system. And at a certain point, we got out of the vehicles with our PPEs just to get one or two views from the communities that were there. And what we discovered in this area is that there is no electricity in a particular area here within Lusaka. So they have no idea of what is going on. Also, there are many people that do not have cable television. So we are able to see the results of what has happened out there, but they're not able to see it at all. So a lot of work really needs to be done because people continue to believe and think that this actually it's not true. It doesn't happen. It's not working. And it also, unfortunately, starts being politicized because people are recovering. So is this a political thing? So for us as media and communicators, I think it's extremely important that the information that we send out there is correct. And we need to do a lot more in terms of the tools that we use to reach the people. Because like I mentioned, in this particular area, there is no electricity. So they have no idea about what it is that is going on. I will go to the next question, and this question is directed to to Ida. This question is directed to Ida from Petronella. I think this is the same question that I asked earlier, and I think you had answered it concerning why is it that there is lower prevention reporting. You answered that fully, or would you like to go through it and add some more on that? Ida?
I think I tried to answer it, but I think maybe I've just have one more thought about it. Maybe it's because people have been hearing, they think it's old news, maybe, but basically it's fantastic news. It's the physical distancing and the hygiene, the hand hygiene, and for instance, not getting too close, especially with our, our mouths when we're talking or singing to people. Those are prevention messages. And actually what's very complicated is that sometimes, I think for instance of Tanzania, those prevention messages are quite difficult to communicate in a country where, church services are encouraged. We know they are dangerous. I really feel for journalists in those countries. So I think whatever is the furthest we can push the envelope in our own countries by being true to science is actually a duty and an opportunity that we have as journalists. So it could be partly because the messages now have been around for a while, but it is the only science so far that is working. So it's an important behavioral and scientific message.
Thank you, Ida. I have another question for you from Mufisa Manchisi. And he says, how can journalists practically integrate data disaggregation that most of the focus in Zambia is usually on event reporting, where journalists usually play a passive role? Despite their questions, they do not really set the agenda, especially on specialized subjects.
Thank you. That's a very important question. And earlier there was also a question about investigations and how to investigate around COVID-19. So just a few things that come to mind is that Of course, event-driven reporting is not the type of journalism that's exciting. It's simply said that he said this and she said that. Our much more exciting role for a journalist is to actually ask ourselves what that means and whether what the person said was true and whether what the person promised, especially if it's a politician, has actually been implemented. So I think maybe a way to go about it, since it's all more tough now that we can move about less, and somebody else also mentioned about freedom of expression being curtailed somewhat, to lesser or more extents depending on where we live in the world. I think maybe a very good thing that a journalist can do is to just very accurately keep track of what has been promised. I mean, every policymaker in the world has promised a certain number of tests, has promised that PPEs would be made available, or have maybe described why they can't be made available, has been trying to buy time for the health system to cope with an influx of patients, obviously. So because the lockdowns and so on have been a lot about just buying time so that health systems can prepare better and not be so overwhelmed. So those are instances that are really true. That's true investigative journalism, is just to say, this was promised and what is the reality. So I think there are still a few opportunities there to be able to play that watchdog role that we have as media. Some of it may be more difficult, but certainly if we only keep reporting on events and what somebody said, after a while, our public will just feel that we're just a mouthpiece, and we ourselves will not actually be doing our jobs as journalists. So look out for those moments when a promise is being made and try by all means to keep track of that promise. And then you'll really be speaking on behalf of your audience, will be seeking truth on behalf of your audience.
Thank you, Ida. Kamufisa, I hope that answers your question. The next question here is from Mangalita Charlie. And I don't know whether Mangalita is which one is the surname and which one is the first name. But the question is, how do we specifically reach learners in remote areas? How do we specifically reach learners in remote areas? I don't know if any one of the panelists would like to answer that question.
Well, I think the first thing that we've been trying to do as BBC Media Action is that we try to reach as many people as we can using community radio stations. Why we're using this is because we understand that they speak the language that people understand. It's a local media, so they will understand content that is being produced there. And if it is content that is produced around COVID-19 and young people, that means it is also produced in a language that these people understand. So I think the best way we can do this is reaching them through community media, and then we can use other platforms. Could be social media, that is Facebook, but we've been very wary and been careful that there's also misinformation around using social media platforms. But we'll trust if we use a platform like a radio station, because it's probably verified, balanced, and unbiased information. I don't know if I've answered this question.
Yeah,
I hope you have.
I hope you have. Just to add to what Meg has said, I think it's also just takes concerted efforts in terms of no one can do it alone. Even as much as we're reaching community stations, I think the onus is on us in terms of to see how best we can package this information to ensure that it reaches as many people as possible, and how we package the information as well. So if you're using a community radio station, for instance, you're using influencers to come on radio, you're sparking discussion and dialogue. And that's the whole point in terms of once you get people talking about it, you're hoping that it doesn't just reach the person that has heard it on radio, it can reach even other people beyond that. And that's why I think it's very important, even as we are packaging the information, it calls for a lot of creativity. Sometimes it takes even a song by a local artist, simple song that is targeting children, for instance, with basic information on hand washing. And once it's going around the community, it's sparking, people are talking about it. So that's why, like I said earlier, the challenge is on us in terms of thinking beyond the normal, because we need to get that information to everybody.
If I come in maybe just with a quick word. I mean, certainly, you know, within the sector and as UNICEF as well, we've really tried a lot of different tactics to try and reach a lot of people. And so particularly in rural areas, perhaps, you know, the methods of working with religious leaders, with traditional leaders. We produce some chitenge with, you know, COVID messages on there, community radio stations, as Mek mentioned. So really need to try a number of different tools to reach these people. But I think particularly for journalists, you know, going back to what I was saying about your audiences, I think we really need to be listening to what people understand about what's going on. I mean, I heard from a colleague at the beginning of the week that she had a friend who visited somewhere in the eastern province, and in the village there, people had heard about coronavirus, but they had no idea there were any cases in Zambia. In other places, they see the schools opening, and the assumption is, oh, it's finished. Must mean that the emergency has passed. So people are, you know, we are an elite as journalists. We get lots of information. You know, we know, for instance, that HIV, you can't get it from hugging someone. And we've heard that millions of times. But, you know, there are people out there haven't received that message. We're bored of hearing about hand washing for 20 seconds with soap or using an alcohol-based sanitizer. But some people haven't heard that message once. So don't assume our audience knows the things that we know. And so we need to, you know, still keep going with these messages and still making the extra effort to communicate, because, you know, our audiences are not as well informed as we are about these things.
Okay, also with the panel, I do have Tolenyata, who is with Internews Nairobi. Tolenyata, maybe you'd like to say something? Tolenyata, are you still with us? Okay.
He sent me a message that his computer had that blue screen of death that we all know. So I think he's just off for the moment, sorry.
Okay, no, that's fine. Additional to what has been said about how do we reach out to remote areas, as Zambia Red Cross Society, we have found that using the public address system is quite effective. We go with these NIST vehicles to these remote areas, and we are able to actually disseminate the information quite effectively. Where the vehicle is not able to go, we do have the handheld public address system. So what happens is, with the face masks and the hand sanitizers, our volunteers will actually go into the villages and disseminate this information. I have a very interesting question here, which is, and I think it's the first time that we will all hear this. And the question is coming from Abigail Mulenga, and she says, and this is directed to you, Mek, and the question is, how do you tell it's enough with COVID-19 information?
Well,
an interesting
at the moment, it's an interesting question, like you say, and thanks, Abigail. Glad that you could join us for this. I think we cannot overemphasize that we need to communicate in the best way that we can. Of course, we should not be irritating our audiences. People will get tired. Like Ada did say that in the time that HIV/AIDS came, those issues around HIV/AIDS and people saying prevent, do that. I think there was a time where people would switch off their TVs or zap a commercial or a message. So saying that maybe it might be too much is a little bit also too much and too early. And I think we need to do so much, because judging from the number of cases we're receiving, it means to say we still need to be telling people more. But what is important, again, is from my earlier session where I said, how do we prepare and coordinate this in terms of using different formats for us to really talk to as many people as we can. So saying it will be too much messaging, not really. I think there could be some moderation if there's too much, but I mean, this is what we were faced with.
Thank you for that, Mek. Additional to that, social behavioral change does not happen overnight. It takes quite a bit of time. So like what Mek has said, we continue to give out the messages so that they can adhere to the messages being given. This question goes to Patricia and Ida. And the question is, When and what time can it be appropriate to broadcast the pictures of the virus to avoid trauma and stress in a TV audience? Patricia and Ida, this question is addressed to you.
I think, well, the pictures of the virus itself is obviously something that's tiny and that is only available to look at through a microscope, and scientists have actually, with animators and so on, have shown us the virus. If you mean actual people who've suffered because of the virus, then I would say there are always ways to interview people which is sensitive, of course with their consent, where they tell you the story. The purpose of it would not be to invoke fear, but the purpose should be to sketch reality. And it's the same sensitivity that we apply to stories about cancer, about HIV, any disease that you may think of, any human rights issue, any issue that affects other human beings. There should always be respect to the person who is in a dire situation, but at the same time, it's truth-telling, and this is a real threat and a real pandemic. So I think if you meant an actual patient, I think the time is there. If you mean the actual picture of the virus, it is scary because we know what it can do, but in another sense, it's a very scientific picture, obviously, but I'm not very sure if I fully got your question.
Okay, because I think so far what we've been seeing of the virus, the picture, I think it looks, I don't want to say attractive, but yeah, there's that picture that normally is shown, reflecting COVID-19. This next question is directed to Patricia and James. How do you package information in a way that motivates and leads to behavioral change? James, maybe you can answer, or Patricia. Go ahead, Patricia.
Okay. I think, like you just said, yes, the behavior change doesn't happen overnight. It takes a bit of, it takes time actually. But what I would say is, in terms of how we package information, I look at it as, when you're making clothes, if something is made to fit you, it's tailor-made, you're more likely to wear it, you're more likely to be confident, you're more likely to want to show it off. It's the same thing with when we're packaging information. We go back to what John said in terms of, think about your audience. What are they going through? Imagine your audience. If you speak directly to their situation, they're more likely to listen to the information. Package it in such a way that it speaks to your audience. If it tailor fits, they're more likely to listen and they're more likely to take action. So we have to understand our audience. We have to tailor make our content to suit our audience. What are they going through? If you're speaking to a person in a rural place, for instance, with no access to water, you need to speak to that situation. And like I said, engage them in such a way that they are helping to come up with the solutions, because they understand the resources that they have. They are better placed to come up with the solutions that they can implement themselves. So I think that's what I would say. John would like to come in.
Thanks. Yeah, I very much agree with that. Behavior change is really tricky. In fact, at UNICEF, we have a particular team that are really focused on that. And it really goes far beyond giving people the messages. I think every smoker in the world knows how dangerous smoking is, but they haven't stopped. We all know that we're supposed to exercise 5 times a week for 30 minutes. How many of us do that? We know we're supposed to eat 5 portions of fruit and veg every day. How many of us do? So we've received the message, but we haven't changed our behavior. And there are many reasons why that happens. When we're looking at how to change behavior, it's one thing getting the factual message across, but then also who's telling the story. So, is it coming from a respected member of the community who can then influence what's going on? I think my particular message to journalists would be that, journalists are storytellers, and stories are extremely powerful. And I think by giving a human face to many of these things, that's really the most dramatic way you can, influence people, hit the emotions as well as the brains, so that people really realize the importance. We don't want some foreigner telling us what to do, but if it's someone who's respected from the community, who speaks with an authentic voice that and a voice that comes from someone like me, then I think that can be very powerful, something that's believable. You know, I think about some of the stories around, you know, those who've maybe refused. There's been some very powerful stories on BBC about, you know, people who've been refused, who've disagreed with taking vaccines for their children, and then their child has got polio, and now when they look back, you know, they really regret what happened. They see the state their child is. They think, why did I believe that these vaccines were dangerous when it could have saved the life of my child? You know, and that's a powerful story, but it's much more powerful than just saying take vaccines because they're good for your kids. So where are the stories of the survivors, of the health workers, of the people involved in the response? You know, all these things. Look for those stories. I think that can be a powerful way that we can tell these messages in a way that's not dry and boring and sounds the same as everything else.
Thank you so much for that, James. Our time is running. I would just like to mention, if at all we do not cover all the questions, we will have another media briefing. And if you are interested and you would like to have another media briefing, we would like to hear from you. That would be very encouraging for us so that we can host another webinar. And also, in the same breath, I would like to appreciate the following media that are with us. We have KFM Radio from Mansa. We have Chete 89.9 from Nakonde Radio. We have Tutor Radio, again from Mansa. We have KFM Radio, that's also coming in from Mansa. There's somebody that has joined us from the Embassy of Sweden. We have Tamanile from Diamond TV. We have Kennedy from Radio Mono community station. We have Matamwa from Save the Children. We have Danny from Zambezi FM. We would like to say thank you. There are others that I haven't mentioned, but we would like to say thank you that you have joined us. We still have a few more minutes, so I will still address a few more questions. This particular question is directed to Meg. And the question reads, recently, almost a month or two ago, we got information from the medical experts saying Zambia should brace for more cases as winter approaches. Winter is here now, and in Zambia Daily Mail newspaper on page 3, we have a story on United States of America ambassador to Zambia cautioning that COVID-19 pandemic could reach its peak in August. How should such a story from such an office be treated?
So we're just, the court season in Zambia begins in June, and this is just the, is it our fifth day into the fourth day into the month of June? So the court season is beginning, it's just beginning. So at the moment, I think you'd also learn something by experiencing and observing what has been said. So if something is, a statement comes out like that, try and see and start asking the science around this. Ask the medical experts. This is the reason why we're talking about preparation and coordination. Ask the medical experts and say, we've heard this been mentioned. How true is it? We all know that during the cold season, it's a flu season. People get flus and there's all these things that come around. So, and probably what is being said here is that when it gets colder, let's be wary that it might be a time that things could really be not too good for us. But my advice is that let's find out really from what the truth is around it being cold. And I'm no medical expert, but the only thing I can say is verify this info with a medical expert.
Thank you for that. And maybe I can direct this question to Patricia. Patricia, where do we get the actual information and how do we know that this information is true?
Maybe before I get to that question, just to add on to what Meg said, I would like to go back to something that Ida shared actually in the last webinar that I had with her, in terms of, I think we are all new at this. COVID-19 is new to everyone. So it's good to even emphasize that even as we're writing or we're coming up with our stories or we're predicting, it's new. We don't really know exactly how it would turn out for Zambia. We don't know how it would turn out for South Africa. We don't know how it would turn out on the Copper Belt. But I think it's good to depict that it is happening. It's good that we're sharing the stories from the experts. Also, we're getting the experts actually to tell us that this could happen or it could unfold in this way. So such things I think are likely to happen because it's new. We don't know how it's going to hit Zambia, but we have seen what has happened in other countries, and we're able to see that, like we've seen, the numbers are increasing, they're not going down. And going back to your question, Esther, in terms of, maybe if you could just go through it again, the next question.
Where do we get correct information, and how do we know that this information is correct? Like one of the panelists had mentioned, I mean, there's social media and there's just so much information coming on social media. So how does a journalist, how does a communication person know that this is the information that I should take out there?
Yeah.
And from which source would you recommend?
Okay. I think, like Ida shared in her presentation, it's very important to verify, try and verify information as much as possible. Think about if you're going to share that information, what possible implications are there? And going back again to our coordination is that if we're coordinating, we know who the responders are, we know who can answer certain questions. So we have IFRC, for instance, we have the International Red Cross consult in terms of who can I best speak to on this, or who can best address this. We have the Ministry of Health, we have WHO. So all those are credible sources that we can go to, but we can research, we can consult, verify information before you share it. And there are people that can help us to verify. We are not the experts as the journalists.
Okay, thank you so much.
Could I add something to that, please? Yeah, I think the journalist, it's very good that you asked the question, because you said that I think the ambassador to the US ambassador said so. Obviously, with any information that relates to science and health, the source should be a science or health source. It doesn't mean that the ambassador said something that's not true. What I'm just saying is, when something is said, then go to a science and health source before you do the story. It actually happens to be true because we have seen there's actually a lot of modeling data being published online that talks about how sub-Saharan Africa, basically because of early lockdown, we actually managed to flatten the curve as a whole, as a continent, to quite an extent, which means it's an even further reason, additional reason, why the rise in cases will be experienced slightly later. As John has said, the cold season has just started. So what that ambassador said, we have seen, we have read online and heard those credible sources talk of the same thing. So while it is true, I just wanted to caution that if it is somebody in the political or diplomatic circles saying something related to science and health, just as I am saying something related to science and health, and I'm a journalist, not a science and health person, go to the source. So, but to your specific question, there is actually good data online that talks about how the rise in cases will hit Africa. I know our advisory panel in South Africa, which is advised by a number of scientists, like most other places in the world, have said that in South Africa, we can now expect our peak to be September. And since we're in the same region, roughly, I have read from reliable sources that can be expected also around July, August, September. So that's a very important takeaway, I think. Very important thing for us all to think about, that it's still coming.
Thank you, Ida. Thank you so much. I have 3 minutes to go. And my question to everyone that is on this platform is, for us to have another webinar, what topics would you like us to cover? What topics would you like us to cover? If you still have more questions, please continue placing them in the chat box, and we will definitely get back to you. We will have, with the response that I'm getting, is that we should have another webinar. And I think this is good. This has been great capacity building for those of us who are journalists and those of us who are in communication. So please do write in the chat box what topics specifically you would like for us to cover. With that, I would like to say thank you so much that you joined us on this webinar. We hope it has made a difference in your reporting. We hope it has made a difference in how you look at things, at your perspective as a journalist. We hope it has made a difference in collection of content and how to approach it. We hope it has made a difference in your being able to look at what our role is in response to COVID-19. To our panelists, I would like to say thank you so much for having accepted to be on this platform. Thank you so much to Meg Peary of BBC Media Action. Thank you so much to John James, UNICEF. Thank you, Patricia, BBC Media. Thank you to Ida Eust, Internews. I would also like to say thank you to some people who are in the background, and that's Genevieve Hutchinson, and also to Sanya. Thank you so much for having come on board, and we will inform you as to the date of the next webinar. Thank you so much, and have a great afternoon.
Esther, before we leave, I think it's important to remind people that we will be sending them the information and resources that we have. So it's best that they share with us their email addresses so that we can then get back to them with all these resources. So by next week, we'll put a package together with more detail, and so that you can be able to use it. Thank you.
Okay, thank you so much for that information, Meg. I hope we all heard that. Please give us your email so that we can send you a package that you will be able to look at. Thank you so much, and have a great afternoon. Bye, everyone.
Thank you.
Bye.